Okay,
All
so
right.
Voices of Verse, we're back. Sarah's live and in person in the studio. Already did an episode, so I think we'll do a quick update, but thanks for flying into San Francisco.
Thanks for having me.
Since we last talked, I think the practice has built up quite a bit, so we'd love to
Yeah.
get a little update on that if you wouldn't mind just giving us a high level on how things are going.
Sure, they're going really well. My practice has grown to nearly 30 weekly clients. So
That's awesome.
I have a lot and I have quite a variety. I think my youngest patient is 4 and my oldest is 80. So I love the span and the variety of clients that I'm seeing. So
Wow, nice.
Yeah.
Yeah, I feel like for us, it makes it so easy when folks are flexible with the patients I take, or if they're motivated to do that. Makes kind of like the sorting hat that we have to do from whoever sees us online to the SLP like quite a bit easier if the SLP is always open to it.
yeah.
I also think Verse is a good opportunity to give SLPs that chance, right? To kind
Definitely.
of broaden their horizons and the types of clients they get to see. And so
For sure.
it's a good, it's awesome that you have such a breadth of clients
Yes.
across the age spectrum, I'm sure across areas of concern as well.
For sure. And yeah, I mean, I have 15 years of experience, but in no way have I treated, everything I could possibly treat. So
Right.
I'm still learning, still challenging myself with these new clients, and I really am grateful for that.
One thing that we talked about earlier that I think would be super interesting to get into a little bit was you talked about how you have friends in the SLP community who feel a little uncomfortable going across the age spectrum.
Yeah.
And you've given them pep talks that, hey, this might actually be something that you're really well equipped to do. Could you tell us a little bit about what that talk looks like and why you think SLPs can be more like Swiss Army knives with who they see?
Yeah, sure. So I have kind of encouraged people to remember, like, we did go to school for treating both kids and adults, and some of the things that we treat with adults can carry over very well to kids. We treat dysarthria, motor speech disorder. So we're treating articulation, granted in a different way, but you can still use that skill set when you're treating a child with an articulation disorder. I think people tend to forget that because we do kind of get pigeonholed in our little bubble of wherever we work and forget that our skills are transferable. And also, just for me personally, I really enjoy the challenge of moving from an adult to a child. And ironically, sometimes you find yourself saying the same thing to both people. So you just really never know what you're going to get. And I like that. The other piece I talk about is like, we work with adults on cognition and executive functioning and attention, and kids need those skills too. So we just teach them in a different way to kids. And so it's just important to remember, like, a strategy for an adult would probably work with a kid if we just maybe reduce the complexity of it, basically.
On the last time that we talked, you said you liked articulation because it was somewhat scientific, or there was like a data component
it's
to
data-driven.
it. Do you find that across kids and adults, the data part of what you do is similar? Are you tracking similar data, or are there different things that you're looking for?
Yeah, I would say it's fairly similar depending on the situation. With adults, it can be a little bit more subjective. When we're treating aphasia, there's not quite as much of that true data point. Same thing with like dementia a lot of times, or cognition. It's treating a strategy and seeing how well someone can implement that. So we're getting a lot more data from the kids in terms of like articulation attempts and accurate percentage and all of that. But the data with adults tends to be more qualitative, I would say.
More qualitative?
Yeah.
That's interesting. I guess with adults are not looking at like age-defined milestones.
Exactly.
Okay.
Right. And it's, more goals like this patient will implement X strategy on 4 out of 5 opportunities. So sure, we could say that they did it 3 out of 5 times, but maybe they needed a certain amount of cueing. And so we're rating like they did it with minimal cueing, or they might do something with moderate cueing. Like there's just, different ways of measuring, I would say.
And you said that at least for motor skills, the way that you approach that actually is pretty similar.
Yes, it can be, depending on like the severity of the dysarthria. A lot of it is just practice on how to articulate and move your mouth in the right way. And that's the same way when you're treating a child with an articulation or speech sound disorder.
Interesting.
Yeah, I was curious, like what are the types of strategies that translate well between ages versus ones that do not?
Yeah, so the things that translate well are things like the slow rate of speech. And because, both kids and adults can speak too quickly. Being really precise with your articulation. So over articulating, that's a big one that I work on with adults and kids, is like moving your mouth, using those articulators to really get the sounds out. Things like that are what really would carry over with both populations.
One of the cool things that we got to do today was we had one of Sarah's clients who's local to the Bay Area come out and hang out with us. And I would just love to hear what a typical case looks like for you when you work with a working professional. So they looked for Sarah's services so that they could do better with enunciation and articulation, not initially from the States, and they're in this big sales position, so they wanted to succeed in that way, which was just a really cool and maybe unique case when you think about bread and butter speech therapy. Most people go to like what they see in the school. So what does a normal case look like for working professionals?
Yeah, so to be honest, this was one of my first like professional communication cases. And he came to me initially wanting to work on accent reduction. But when we got into things, he does have a slight accent, but it really turned out to be he needed to work on some of those things I just spoke about, slowing down his rate of speech, over-articulating, being very clear, because he would find himself a little bit anxious when he would have to present to executives.
Yeah.
And so we work on strategies to reduce the anxiety, to improve self-confidence. One of his biggest things was trailing off when giving a presentation. He would say, and my next point is, and then just trail off, and it'd be like, you were about to say your point, and then they couldn't even hear it.
Part, right?
You need to keep your voice up and keep that articulation as clear as possible. So that's the type of stuff that we work on, and I think that's one reason I love working with Verse, is the type of client that I get. I just never know what's going to be going on with them. So it's like I have that client who's a more, I would say, non-traditional speech therapy client, but we do work on professional communication, and it's just as important as communication at school. So, it feels great to help people on both ends.
Yeah, absolutely.
Yeah.
One of the things that I think Danny and I have gotten away from a little bit, doing a direct-to-consumer startup and not doing as many salesy pitches, and we don't have the boss to try to impress. I don't get that nervous energy of presenting myself with our job very much anymore.
Not at all.
No?
Used to have it, but
Danny doesn't make you nervous?
sorry to say.
I should. No.
Yeah.
I think we've gotten we've worked together so much that it would be really hard to be nervous about anything that each other says.
That's great. That's good.
I think also a big part of it is that I actually love working with SLPs. I love talking to them. I'm interviewing them all the time. They're such fun people to talk to, so interesting to hear about different backgrounds. I spoke to one today who's also looking at marriage and family therapy and how to incorporate that into her practice.
Yeah.
And it's just there's so many realms around speech therapy that could benefit it. We talked a little bit about how mental health has a big component in it as well.
Right.
And so just kind of rounding out the approach, understanding cultural aspects, mental health aspects of it, just kind of really makes for a really great therapist.
For sure. And one thing about the client that I was with today is just seeing his motivation to improve and participate really made me consider what role I could play in a corporate speech therapy type setting, or just helping people with efficient communication, because if we can help companies communicate better and more effectively, that will affect their bottom line. So it's possibly something for us to continue to explore and get into. And I really enjoy working with professionals.
Yeah, absolutely. We talked about it a little bit earlier, but it is interesting how self-motivated someone could be at a professional setting.
Yes.
Yeah.
The bottom line thing is crazy, especially if you have a quota and you feel that that's going to directly move the quota. That's something that we as a business have not looked into enough probably, but I think it's really powerful.
Right. And like you said, it's hard to imagine someone like him needing speech therapy. And he doesn't truly need speech therapy in like the most traditional way, but he is benefiting from it. And it's not like the kid coming to school speech who doesn't want to be there. This is someone who's very motivated. And so seeing progress is going to happen because they're willing to do the things that you're asking them to do.
And they can kind of directly measure that progress, right? And how they're performing at work, too.
So true.
Like he's got his quota goal, and he said he's almost meeting that goal, and he's already seeing improvement and progress. And so there's huge. Not much more you could ask for.
Yeah, that's huge.
Yeah.
And like getting the external validation from it as well, right? Like you can have your therapist saying, yeah, you're improving, but seeing how that translates to real life and the real problems is...
For sure.
It's powerful.
It is.
Yeah, you'd probably rather get the validation from peers than a therapist or your W-2.
Right. Because your therapist is supposed to support you and give you that feedback. But when you actually carry over what you've worked on and hear the feedback from someone else, I mean, I don't know that there's much better than that. So, yeah.
Were you saying?
No, it was really cool to have one of your clients come and stop by. I mean, especially for us to meet a client with their consent, right? Understanding, like it was really cool for us to do. So thanks for the opportunity as well.
Of course. I enjoyed it as well because I've only met him over the computer.
Yeah.
So that was cool.
Yeah, one of the things that is nice about it is when you're building software for this stuff, it's hard to empathize with someone whose shoes you're not directly in.
Yeah.
So we build a software that 50% of it helps kiddos out. We're no longer kiddos. So it's really cool to talk to someone who's at a startup because that's literally exactly what we're doing. We're like, how do we help you do the thing that we know best?
Yes.
So that was a really refreshing conversation.
Yeah, that was awesome.
Yeah, I mean, like, how's the rest of the caseload looking at this point? So we talked about variety, you got 30 folks, you have some kiddos, you have some professional communication, like any other cases that are really standing out?
Yeah, I've got a couple that there are adult patients who unfortunately have degenerative diseases, but I'm working with them on finding alternate modes of communication. So 2 that I'm exploring devices through Lingraphica with right now. And so that's really exciting to see them get excited about it. And one, for example, is truly losing her voice. She has multiple systems atrophy. And so she barely has any voice right now, but she's cognitively intact.
Yeah.
And so she can actually use the device and program it. And her husband is totally on board with this. I guess he and his son had talked about coming up with some device that would communicate for her, so because he didn't know that they were already in existence. So the whole family's on board, which is really great. And so I'm really enjoying that because I haven't had too much experience with adult AAC. And then in the same vein, I have a 4-year-old who's nonverbal. And initially, the mom was kind of like, I don't really want to go down the AAC route. I want him to develop verbal language. But I said, he's really showing signs that he would benefit from a device. And so we got one, and it took almost 3 months for her to buy in. But now he's communicating like 4-word sentences with the device, and it's so exciting. And the other day during my session, he asked for a snack, and the mom didn't get it for him immediately, so he went back and he said, I want a snack. And then he went to the other page and found please and said, please. And she and I we almost cried just because it was such a meaningful way of communicating, and we've just seen so much growth. So yeah.
It's really interesting that you brought up that dichotomy because in my head, not being as close to it, I would think that parents might be more hesitant to use the device, and I was applying that to adults, but it sounds like adults are actually a little bit more excited to use the device.
It depends on the adult for sure, but like for this woman in particular, I think it's going to really help her out. She loves to have conversations with her family. They still go out to eat. So the device you can program like with your favorite restaurants' menus, so she can order her food, and then she can have like the Lingraphica rep gave me the idea of like having her physical therapy exercises recorded on it. So all she has to do is click a button, and then it will show her the physical therapy exercises she has to do. It already has all of her basic information programmed. So any topics that she really likes to discuss, we can personalize it to include that. So it's really exciting for her.
Wow.
Yeah.
Do you find yourself in your role ever having to coach someone through that? I could see some folks feeling like they might be losing some independence when they have to take a step like that.
Yes, for sure. And that was part of my conversation because I actually brought up the device at the initial evaluation. And so I wanted to be very clear with her that
Interesting.
I wasn't giving up on her, and I wasn't saying you're not going to have verbal language anymore or have a voice anymore, but we want to be prepared for the day when you might not.
Yeah.
And so that's where we are right now. Is she still has a voice, but it's very weak and very hard to hear. And so this takes a lot of the strain off. And so when she's having those times when she's really tired, she can move to her device.
When you're in SLP, are you able to identify something like that, even pre-evaluation, just off of the first time you have a quick conversation with them? Or was this something that you discovered like while you were evaluating?
Well, so for her, I kind of had the idea in the back of my head just because I had a little bit of information.
Okay.
But as soon as we started talking and I could see how taxing it was for her,
Right.
there was no question in my mind that it was the right thing to do.
And Sarah, perhaps not for this client, but is it ever the case where you might recommend an AAC device, but then there's also the verbal part that you encourage so that they kind of work off of the AAC device?
For sure. And I mean, sometimes like if you have someone with something like ALS where they still have a voice, what we do is we start voice banking. And so we'll record as much as we can while they still have their voice. And so they're not necessarily using the AAC device at that time, but then in the future when they need it, the device is programmed with their own voice.
Yeah, wow.
And so that's pretty cool.
That is really cool.
Yeah.
Do they use AI for that, to take the voice and scale it into different words?
You know, I don't know. We should. Somebody's got to be working on
Still gotta
that.
get there.
But
That's
I
crazy.
mean, it
never
certainly
thought
wasn't
about
a
that.
thing like a few years ago, but now I wonder about that.
Yeah. How hard was that process for folks to voice bank? Because it's, the
not
device in the
easy.
future is only going to be as good as the work that you put in
Right.
up front.
It's not easy, so you really have to stay on top of it, and the patient has to be very willing to do it. And if they can't do it or they're, tired, the device has its own voice, and so you can always just use that. But
Yeah.
with AI, you could maybe have it sound more like you.
Yeah, I think that would also just be a really nice human experience because
It would.
It's not the same soundtracks of yourself. I
Yeah.
could see myself getting a little burnt out by that. Like if I
Yes.
only had a yes and a no, I don't know. I think it's pretty cool that you could just form new sentences with your old voice.
Agreed.
you know?
Agreed. Yeah.
Interesting.
Pretty amazing. Yeah.
That could be a rabbit hole that we could go
I
down
know.
forever. And I know that you got to catch a flight, so I think we can just cut it there. But thank you
Okay.
so much for the time that you spent with us
Yeah,
today. We got
thank
some
you
videos
guys.
coming
so much,
out.
Sarah.
So
This has been a great day. I've really enjoyed my time with you.
heck yeah. Well,
Yeah,
welcome to
awesome.
San Francisco.
Well,
Hate to
thank
see
you.
you go.
Yeah, I know. Hopefully I'll be back.
Let's go.
Anytime,
I'd love to have you.
anytime.
Yes. All
Cool.
right. Well, thank you guys.
Thank you.
Sweet.